Hey, it's me, Riffy. Hope you guys are ready to move on with the brain. This is nervous system notes, part 4B. We're moving on with the brain. The last thing we discussed in the last video was all the different lobes of the brain, how it's divided, central sulcus, gyri. We talked about those things. Now we're going to start dividing the brain into the actual lobes and start discussing things that go on within them. So without further wait, here we go. What you have to understand about the brain is each lobe has smaller regions that it can be divided up into that are concerned for sensory information, and some stuff are concerned with motor command. So there's parts that take in information, there's parts that process it, and then there's certain sections that will actually send out signals for responses. So we're going to talk about those. So you take the brain as a whole and you're going to break down to smaller and smaller parts. But one of the biggest things that you have to understand before we can get into the lobes is that each hemisphere of the brain actually receives and sends motor commands based on the opposite side of the body. So what I actually mean by that is, let's take a look at this body diagram right here. As you can see, we have the brain up here in the top portion here. You have the different hemispheres. Since this is the anatomical position, this is the left side of the body. This is the right side of the body. And here are the two hemispheres of the brain. So let's play pretend. Let's say that this person randomly gets stabbed repeatedly in the leg. Well, since that happens to be the left leg, a signal is going to be generated, a sensory signal, that is going to travel to the right side of the body, or the right hemisphere of the brain. So the two halves of the brain work for their opposite counterparts of the body for sensory and motor information. So let's get into the actual frontal lobe itself. The frontal lobe of the brain is, in fact, in the front. It's a really clever name scheme. I know, you're just blown away by it, but the frontal lobe of the brain is located deep to the frontal bone of the skull. So the bones of the skull and the lobes of the brain kind of share that common name based on where they're located. But the biggest things that the frontal lobe of the brain does is it plays an integral role in the following functions, such as memory formation. Not memory storage, but memory formation. Memory storage is typically done somewhere else. The formation of emotions. These are things like rage, depression, anxiety. All of these emotions are taken care of or processed or developed in the frontal lobe. You also have decision making or reasoning, and you also have personality. All of these things occur in the frontal lobe. It's a very, 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 very busy portion of the brain. Part of that decision making and reasoning has to do with you make decisions based on the prediction of future events. So this is kind of like where your brain comes into play and being able to predict what could or should happen within the brain. Or not within the brain, within the body. So if we take a look at this, the frontal lobe is going to be everything that you see here in blue. The dividing lines for the frontal lobe are going to be the central sulcus. So this dividing line here that travels its way down the entire brain is going to divide the frontal lobe from the parietal lobe, which is going to be here in green. And then you have the lateral sulcus, which one's right here. That is going to divide the frontal lobe from the temporal lobe. So, as you know, the cerebral cortex, or that rind of the brain, has the high concentrations of gray matter, which actually is involved in a lot of the processing and integration of information that the brain receives and sends out. So what we're going to do is we're going to talk about the cortical regions, where there are parts of the cerebral cortex of the frontal lobe that actually have big major functions in what we need to do. So we're going to call those cortical regions. The first one is called the primary motor cortex. The primary motor cortex is actually located anterior to central sulcus. So what that means is, if you have the central sulcus and you look towards the front of the body, it's actually going to be located on that first gyrus that actually extends down the left hemisphere and down the right hemisphere. What it does is it controls the movements of the body. And it's located immediately anterior to the central sulcus. What you have to understand is, keep in mind that that hemispheric lateralization thing is when you have a right primary motor cortex and you have a left primary motor cortex. So that is based on the hemisphere of the brain. So the right primary motor cortex is going to control all the movements for the left side of the body, and then the left primary motor cortex is going to control all the movements for the right side of the body. And these are direct voluntary movements. These aren't those involuntary things that you do, such as respiration, heartbeat, and things like that. Then what you have is called the somatic motor association area. What this does is it works with the primary motor cortex, but it coordinates things like learned movements. So the ability to hold a pen or a pencil in your hand and actually move and write in a particular way, that is a learned movement. So the somatic motor association area works in cooperation with the primary motor cortex to generate the movements associated specifically with learned activities. These are things like dribbling a soccer ball, dribbling a basketball, shooting. All of those things coordinate a learned movement with the primary motor cortex. Something that I also want you to see here is that if this is a superior view looking down on the top of the brain in the left and right hemispheres, you'll notice that the central sulcus runs right in this particular area or region, right here. So the central sulcus is also going to be the dividing line of where you're going to be able to locate the actual primary motor cortex. So what you'll notice is the primary motor cortex is on the anterior side of that central sulcus, so it's going to be highlighted in red right here. The cool thing about it is, and you got to visualize this, imagine that we took the brain down the longitudinal fissure and just kind of pulled it or separated it apart a little bit, because they're not attached right there at the very top. But if you pulled it apart, what you'll notice, it kind of goes down deep into the brain. That's where this line comes into play on each side. Well, the primary motor cortex, we have learned as scientists that there are specific spots in the primary motor cortex that are designated for movements associated with a very specific part of the body. So if you look at this, if we started deep inside the lateral fissure here, you'll notice that as you go up the lateral fissure around the cerebral cortex, you'll start noticing that there are very specific structures that are controlled in that very specific region of the cerebral cortex. For example, on the right-hand side of the body, on the right hemisphere of the brain, you'll notice that as you go up, the first thing that comes in contact or that is controlled are the toes. So if I wanted to move or wiggle my toes of my left foot, this region of the primary motor cortex would be stimulated and send a signal out to my left toes. And as you go up, you can see it's divided. So you have knee, hip, trunk, shoulder, arm, elbow, wrist, hand, fingers, thumb, neck, brow, eye, face, lips, jaw, tongue, pharynx, and larynx. And it is the exact same thing on the other side, but this particular portion is going to control the movements for the right side of the brain. The term that it is described for this is called the homunculus, and it actually occurs also for any of the sensory information coming in. So the primary motor cortex and the somatic association area are two cortical regions associated with movements. Now we're getting into a third cortical region that is associated with a lot of the thought process. This is called the prefrontal cortex. The prefrontal cortex coordinates information from all the association areas of the entire cerebral cortex. So all right up here in the very front of your brain is an area where all the information that comes in, the sensory information that comes in the association areas, is processed, gets routed right up here. And all of it is combined together so you have a few abilities. One of them is to predict future events or consequences. This is not being a psychic or being able to predict the future or see in the past or things like that. What it means is you're processing a sound, you're processing what you're seeing, you're processing a taste, you're processing a smell, you have pain, you have all these things that come together right here. And you process all the incoming sensory information, and it allows you to make decisions based on what could happen in the future. This is also where you have your awareness of time, of how you are able to recognize the sequence of events that occur throughout time, and then eventually also what could happen in the future. Another thing that you'll notice is this is also where frustration, tension, and anxiety actually results, and those result from the coordination of all of this sensory information coming into one place. So all of the sensory information that comes in could actually cause the generation of frustration, tension, and anxiety based on the amount of stimuli coming in. This video, not too long or anything like that, but what it is unbelievably amazing. In the early 1900s, with that frustration, tension, anxiety, rage, and all of these problems that are associated with the brain, a gentleman came up with a procedure called a lobotomy. And I'm not going to give you very much information, but I want to show you the actual video so you can kind of see what went on in this procedure that was, at one point in time, medically accepted within the United States.
He was an idealistic doctor, hungry for fame, who would champion one of the century's most infamous medical procedures.
He wanted to solve the problems of psychiatry, and he wanted to do it fast.
The lesson here is not how a man can go off the rails, but is how science can go off the rails.
Ellen Ionesco was the first patient to undergo a procedure Dr. Freeman had perfected only weeks before. He called it transorbital lobotomy.
In a transorbital lobotomy, Freeman would first have the patient rendered unconscious through the use of the electroconvulsive shock machine.
Just before he threw the switch, we all had a laying on of hands and went for a little ride.
Usually 3 successive convulsions are necessary, but in old people a single one may be sufficient, while in a sturdy young person 4 or even 6 convulsions may be administered without danger.
The patient would then enter unconsciousness for a relatively brief period, but several minutes.
Now that the convulsion has subsided, the nurse holds a towel over the nose and mouth of the patient.
Freeman would peel back each eyelid, insert his ice pick, and with a hammer, tap through the brain, wiggle it about, sever the frontal lobes, withdraw it. And when the patient came to, he or she would be given dark glasses to hide the black eyes they'd been given.
We didn't have a refrigerator, we had an ice box. The first ice picks came right out of our kitchen drawer, and they worked like a charm.
Turning now to the operation itself, very little preparation is necessary for transorbital lobotomy.
The instrument was put in above the eyeball and in the plane of the nose. You could feel it hit the roof of the orbit, and then with a tap of a hammer you could knock it through. The whole thing would take 3 or 4 minutes.
This patient came to the hospital this morning after breakfast, and he will leave tomorrow afternoon.
There are reports which he proudly writes down in his diary about fellow professionals fainting as he proceeds in this, or vomiting.
Dr. Watts didn't say anything. He simply turned around and walked out.
Spurred on by Freeman, the number of lobotomies performed annually soared from 150 in 1945 to over 5,000 in 1949. Despite the known side effects, there seemed to be an endless supply of willing patients. Ultimately, the fate of lobotomy would be settled by a pill. In 1954,
So, in instance, this doctor figured out a way to, what he was kind of curing was insanity or psychological issues by taking, for lack of better terms, an ice pick, inserting it above the eye, hammering it through the orbital bone into the brain, and essentially using it to sever the neural connections of the frontal lobe with the rest of the brain.
a new drug called Thorazine began to sweep through state mental hospitals.
Thorazine was initially marketed as a chemical lobotomy. I mean, this was seen as a selling point that it produced results similar to lobotomy, but without, of course, all the risks of the surgery.
Freeman decided to move to Los Altos, California, to resurrect his career. Far from the reproachful Eastern medical establishment, he could try to bring lobotomy to new categories of patients.
If housewives found their early 1950s existence too depressing for words, why, Freeman had a solution that would get them through their day happy as little clams. If children were misbehaving, conditions we might now see being called hyperactivity disorder, why they might need a lobotomy.
In all, Freeman lobotomized 19 children under the age of 18, including a 4-year-old. By 1967, Dr. Freeman had personally performed more than 2,900 lobotomies. In February, at Herrick Memorial Hospital in Berkeley, he performed his last when a patient died of a brain hemorrhage. Freeman was stripped of his hospital privileges and soon retired from his medical practice.
Unbelievable, the things that can go on in medicine. So now you probably see why that was a possible theory on how to solve that, because of everything that goes on in that frontal lobe. If you can sever the connections, you can cause all those things to stop working in the way they do. So rather disturbing medical procedure, which obviously I don't believe is actually done anymore without unbelievably severe cases. The fourth cortical region we're going to go over is called the Broca's area, or the speech area. You're going to need to know it as both of those, but what it does is it controls the facial neurons for speech and language formation. It's located only, keep this in mind, only on the left frontal lobe, just superior of the temporal lobe. What it does is it controls all the patterns of breathing and vocalization required for normal speech. What I mean is, in order for you to speak, you have to pass air through your vocal cords, which contract and expand and relax based on the type of pitch, tone, and volume you're trying to create. So your Broca's area for speech actually coordinates the breathing and vocalization that's required for me to talk to you just the way I am. The crazy thing about it is it worked collaboratively with what's called the auditory association area and the Wernicke's and general interpretive area, because what it does is as you talk, you take in feedback from the sound, so you're processing the auditory sounds, and you're also interpreting what you're saying in order to make adjustments to the speech through feedback. So if you find yourself talking extremely loud, you can hear that feedback, and if you need to talk louder and louder, you're getting that feedback, and so your Broca's area will adjust based on the feedback it's getting from all those other areas. And I'll show you where this is located here in just one second. So then you also have the frontal lobes. The frontal lobes, of the frontal lobe, you also have what are called the olfactory bulb and nerves. These aren't a cortical region, but they are an exact cranial nerve. Remember when we were talking about nerves, you have spinal nerves and you have cranial nerves. Spinal nerves run into the spine. There's 31 pairs. Cranial nerves, there are 12 pairs of cranial nerves. And the two that we're going to talk about right now are the olfactory bulbs and nerves. They're the first cranial pair, and they are actually attached to or sit just on the frontal lobe. And so they're called the cranial nerve pair N1. They're the only cranial nerves that actually attach to the cerebrum, and they're the location of the olfactory nerves. So in your nasal cavity right in here, you have olfactory nerves that penetrate through the ethmoid bone and are in your nasal cavity. Their main job is to absorb smells or chemicals, and they cause chemical change in those nerves. Well, all of those olfactory nerves penetrate through that ethmoid bone and synapse with the olfactory bulb. So that would be an example of converging neural pool, and they synapse with the olfactory bulbs. If you remember, you have two nostrils, you have two sides of your nasal cavity, so you end up with two olfactory bulbs. If you look at this picture right here, I know it's kind of hard to tell because it's sitting behind the text, but this is the olfactory bulb right here. This is the frontal lobe of your brain. These are the olfactory nerves. See how they're penetrating into the nasal cavity right in here? And so any of the smell and air that you pick up gets absorbed by these nerves, and they converge on the olfactory bulb, and then it's routed through the olfactory nerve to the olfactory centers of the brain. So signals that are absorbed travel from down the olfactory tracts to the olfactory centers for smell processing. If you look in this human brain here, you have the inferior view, or looking from the bottom of the brain. So the olfactory bulbs sit on the right and left hemispheres of the brain just underneath it, and you'll notice this is the tracts right here, the nerve tracts that'll extend back to the olfactory centers of the brain. If you're looking from an anterior view of the brain straight on directly, it kind of looks, they're right here, and they sit just underneath the frontal lobes. Since we are doing a sheep brain dissection, I thought it would be very worthwhile to make sure you guys knew where to find these on sheep brain. So this is an exact sheep brain. It's an inferior view, so you're looking from the bottom. And what you're looking at here is the actual sheep brain olfactory bulbs are right here and right here. When you get your brain for dissection, you're actually gonna you'll find that they look like they're directly attached or part of that cerebrum of the frontal lobe, but really and truly you can kind of peel them back, and if you are really delicate or careful, you can actually see the tracts or the nerves extending back down into the actual brain itself. So if we're looking at the frontal brain, keep in mind, central sulcus is a big dividing line. So that central sulcus is what's going to divide the frontal lobe from the parietal lobe, and then you have the lateral sulcus here, which divides the frontal lobe from the temporal lobe. So we're going to go over those major structures. One of the big things that you need to know is that central sulcus, anterior of the central sulcus, is where the primary motor cortex is located. And the primary motor cortex is on what is called the precentral gyrus. So you see this giant ridge here that extends all the way down, and that's the precentral gyrus. Remember, that's where all your movement signals are sent out, and that's where that homunculus comes into play. So each little portion of this right here has an exact body part that it's associated with sending a signal out for coordinating the movement. You also have the Broca's area. Remember, Broca's area is for speech. It's just above the temporal lobe in front of the precentral gyrus. Then you also have the olfactory bulbs that sit underneath the frontal lobe and extend back into here. There are 2 olfactory bulbs. And then you also have the prefrontal cortex. It is worthwhile making sure you understand that in this area right here is the somatic association area. That's where the learned movements are coordinated with the actual primary motor cortex that send out the signals for those movements. So they're going to talk or communicate back and forth, so you're doing the learned movements appropriately with the right muscles. And that's where we're going to stop. In the next video, we'll cover the parietal lobe, just like everything else. I know this video is 22 minutes long, but keep in mind about 6 or 7 minutes of it was that video on lobotomies. I just thought it was so interesting and unbelievably gruesome. But if you have any questions whatsoever, make sure you give me a holler, and I'll help you out. Best of luck.